Hi, welcome to Sunshine Dental Solutions. My name is Dr. Nadeem Ahmed, and I'm here for a very specific reason today because I'm going to help you in your practice, in your dental practice, not only in your dental practice as a business, but I'm going to help you in your clinical practice because as you know, if you're a dentist like me who's been practicing for 20 plus years, times have changed, times have evolved, everything's become more expensive, even on the dental side, acquiring dental materials, in terms of technology, in terms of regulation. I mean, I won't say it really out loud, but I'm going to say it out loud. The glory days of dentistry are still here. You just have to know how to extrapolate what you have. So I'm here to tell you that you have all the basics. You have the knowledge, you have the practice, you have the information. You just have to know how to translate it into making it a highly profitable business. Now, the thing is, the great thing about dentistry for us is that you don't need to really sell anything. You know, when you have a patient come in and they've got a toothache, they've got a legitimate problem that they want to have addressed. So it's not like you say, oh, you've got a problem. No, they know they have a problem. Also, you have people who have wants and desires. Now, what limits us as clinicians is what I'm going to help you with, because I notice that there's a lot of clinicians I work with, even in practices where we're doing over $1 million a month. Now, that wasn't a mistake, folks. I'm talking about doing $1 million a month. How do you do that? That just doesn't happen. Oh, well, that just happened. No, it takes effort. It takes effort on the marketing side. It takes effort in the management side. It takes effort, actually the most on the clinical side, because you have to be able to deliver the products. These type of practices and situations don't develop by just saying, oh, well, I'm comfortable at what I'm doing. It's very good to be comfortable at what you're doing, but you have to know how to adapt to different situations. And I'm going to give you a little bit of snippet because I like to drive cars on the racetrack. So if I'm driving my car at Daytona, let's say there's a very high speed raceway just down the road from me here in Florida, because I'm in Florida right here, and I will drive my car 160, 170 miles an hour around that track. But then I can drive that car at 15 miles an hour on a slow road. So you've got to adapt to each situation. You've got to know when you need to go fast and when you need to go slow. And also developing that speed, it doesn't happen by just trying to be fast. I meet so many dentists, they're saying, oh, I'm so slow. I don't know. I said, you know what? Speed comes with confidence. It comes with doing the procedures. And that's what I'm going to share with you today, folks, because let's face it, you've been bombarded with CE, and most of the CE that you get, it's always geared towards some objective of selling you something. Now, if you're like me, I'm sick and tired of people selling me things that are useless to me, or that I have to use as bragging to the patient. Well, I'm a great dentist because I have this piece of equipment. You're going to be a great dentist because you're great. We're going to make you even better than you are now. So if you're already great, kudos to you. If you're on the fence and you just graduate and you're saying, you know, all these places I can go to learn more advanced dentistry, where should I go? You're so confused. And then you think, well, let's pick the most expensive place because maybe they've got the best course. You have no idea. I have some relief for you. I've done the courses. I've been there, seen it, done it. And what I can do is I can help you cater your practice to you. So for instance, you've got a big case coming in. I'm going to be sharing these cases with you. I've got hundreds of them. Listen, it's not, oh, well, Dr. Ahmed, you did a case back in 2003. No, we're doing large cases all the time. And the weird thing about large cases is they're always there. It's just you have to be able to recognize them. Then you have to be able to appreciate the patients that are actually wanting that kind of treatment, because, you know, there'll be the tire kickers. There's going to be the people who are, you know, not really interested in it, but they're engaging you. And there's very simple strategic ways of engaging those patients so that you can know right away, you know, what level are we at? You know, I know some dentists tell me all the time, they're like, oh, I don't talk to my patients about money. So I'll give you a quick example. And I could share all the secrets with you here, but I want you to call me one-on-one. Now, here's the best part. You can go to my website. sunshinedentalsolutions.com, and you can get a hold of me one-on-one. We can have a conversation. We can have a conversation about how I can help you in your practice. And it'll be very specific. It's not, Doc, I'm not here to waste your time or mine. I know that you're going to be able to benefit from what I'm telling you. It's just, you're going to have to give us a call. You're going to have to make the step. And if you're one of those cocky dentists, I love you too. You know, I know it all. I'm doing fabulous. Great. God bless you. But if you're one of the normal dentists like I was, listen, I'm a bread and butter dentist, and there's more of us. There's loads of us that have to practice day in and day out and help regular people do great things. I'm the man for you. So let me give you an example. Somebody comes into your practice and, they come in and they say, oh, Doc, I'm interested in implants. And then all your staff are, dancing around thinking, whoa, this patient's walked in, they want implants. And you ask the patient, sir, what would you like? How many implants would you like? Well, I'd like all implants. Well, a lot of times, we as dentists, we kind of get, oh, let me educate you. Let me let you know what you need and what you should do. It's very simple right from the get-go. Have you researched this, sir? Because most people have researched it already. And what are your expectations in terms of cost, in terms of that procedure? And if they say, well, I think the most common one is $5,000. It's going to cost $5,000, and you're going to be like, okay, so if our budget is $5,000, let's talk about what we can do for you for $5,000. It's really simple, folks. And then if they say, no, well, I want to know all the options, great. Let's go from here to here to here, and then we'll talk about the $5,000. You're never going to close the door on them. I get so many patients from other practices who tell me, and I ask them, why did you leave that other practice? It's because the dentist was dictating the treatment. So I'm saying that you've got to use a little bit of suave with the patient. You've got to be with them. You don't want to feel like you're on this side of the fence and they're on this one, because they're always going to tell you, well, the dentist wanted to do this, but I wanted to do this. How come in a one-on-one conversation it becomes you against them? You got to be on the same page. So I always tell the patient, listen, I'm on your page. I am your servant. I am here to facilitate your oral rehabilitation. I am here to help you. So you getting the message. They got to know that I'm on their side. So it means that they don't have to spend anything with me for me to be on their side. So many times we're sitting there going, oh, this patient's my really good patient. Why? Because they spent a lot of money. But folks, what you're going to do is you're going to plant the seeds with them. So that's just a little snippet. That's a very specific example of those implant consultations that you may have. And folks, I'll tell you what, we'll be talking about all facets of patients. And what I'm going to do is I'm going to share with you some of my cases, because I think you're going to be very interested in seeing them, because it doesn't involve, we don't have a one-track mind here at Sunshine Dental Solutions. It's not, okay, take out all your tooth, put in 4 implants and put a hybrid on there. No, that's one way of doing it. And you know what? Your patients, if they go to that type of place, that type of office, that type of clinic, that's all they do there. Do you think they had any other choice? Really? And I always talk to people when they've got problems. What were you thinking when you decided to take all your good teeth out? And in a very respectful way, I never talk down to my patients. I always tell them, what were you thinking when you decided to remove your teeth? Well, I thought it was the best solution. I said, who told you that? So folks, here's the deal. Do yourself a favor, pick up the phone, go on my website, contact me one-on-one. We'll have a little conversation about what you want to talk about. And then we'll talk about solutions about what you want to talk about or how to improve them. And you will be empowered. So I look forward to seeing you soon. Look at my cases. And actually, when we're discussing the consultation, I'll show you how you can do those cases. And you may be one of those dentists out there saying, well, this guy, I already do those kinds of cases. Yeah, but I'll talk to you about how we do them efficiently, and we don't have to spend an arm and a leg to do them, because you may be thinking, well, I had to have this CAD, and then I had to have this and that and the other, and my expenses are sky high. I did that case for $50,000 and I didn't make a penny because my expenses were so high. Well, I'll talk to you about how you can do elaborate, advanced restorative cases, and you can do it on a budget, so you can save the patient money and it can be good for your business. So I'll see you soon, guys, and check us out, sunshinedentalsolutions.com.